Good morning, good afternoon, and good evening to all those joining, and welcome to session 1 of the This is Public Health Global Final Showcase webinars. My name is Margaret Kaseje, and I'm the president of the Association of Schools of Public Health in Africa and a member of the Global Network for Academic Public Health, and I will serve as your moderator today. Just a few things to note. Please feel free to submit questions for our presenters by using the Q&A button. We will save questions for all after the presentations. The This is Public Health, or TIPH, is a global grant program generously supported by Dr. Richard and Mrs. Linda Riggleman, provides awards to academic public health institutions around the world to develop campaigns that increase the visibility of public health and promote awareness of public health issues, education, and career opportunities worldwide, with a specific emphasis on local communities. The second cohort of This is Public Health Global Awarded Grants is to 12 academic public health institutions from 10 countries all over the world. So we can see that our webinar starts with the first group, and this group is going to be presenting today, and we have 4 presenters. So at this point, I'd like to invite our first presenter, Julie Saunders. Julie is from the University of Western Australia, and she's going to present on community-driven public health interventions in low and middle income countries. So welcome, Julie.
Thank you, Margaret. I'll just share my screen. Excellent, that should be fine. Thank you all for attending. It's a real pleasure to share our project with you all. My name is Dr. Julie Saunders. I'm from the School of Population and Global Health at the University of Western Australia, and I'm presenting on behalf of my colleague Anja Stasinska and also our student ambassador Neve Garland, who's listening in today. Before I start, I would just like to acknowledge that I'm in Perth in Western Australia, and that's on the land of the Whadjuk Noongar people. And so I'd like to pay my respect to elders past, present and emerging, and acknowledge that that land was never ceded. That doesn't want to click through, one moment. Okay, so the School of Population and Global Health has been running field trips to India, Nepal and Fiji for quite a number of years now. And we typically work with non-government organisations in areas around maternal and child health, water, sanitation and hygiene, and more broadly physical activity, nutrition, sexual health and social determinants of health. So in 2023, we took 2 field trips, one to Nepal and one to Fiji. And we introduced an additional component related to our This is Public Health project grant, and that was specifically around increasing awareness of the different public health issues in low and middle income countries, and also trying to come up with some intervention strategies to potentially prevent some of those issues. And so the This is Public Health component really enabled students to identify and, I guess, address a more diverse range of public health issues and determinants that they would have got to previously. So in terms of the Nepal field trip, we had 15 UWA public health students. They were a combination of undergrad and postgraduate students, and they were partnered with 16 students in public health from La Grande International College. So that was a real opportunity for students to share culture, share approaches to public health and share ways of working. And we worked with our non-government organisation collaborator, Kanch in Nepal, to look at water, sanitation and hygiene issues around Pokhara. We also were able to undertake a needs assessment of what's called emergency rooms in secondary schools around Pokhara, so that's sort of first aid rooms and that kind of thing. And the ability to undertake that extra project was a direct result of our This is Public Health grant. And as part of their assessment, and also as a way of kind of engaging with the project and the communities that we were working with, students all created 3-minute videos which identified public health issues and determinants in Pokhara. And we promoted these videos very widely on social media. So I'm just going to show you one of those now.
health is a multidisciplinary field that seeks to achieve health equity and disease prevention by addressing the social determinants of health. But public health can mean many different things to many different people.
Eating healthy and drinking clean water.
For the public health is like for the me in Nepal, like it's like a menstruation problem.
Public health is to get an access if there is any kind of injury or any kind of medical assistance.
Exercise, clean water, clean food, fresh food. Public service. Yeah.
The public health for me will be happiness.
Public health is not just a concept, but a way of life. As we journey through Pokhara and Nepal, we can explore how public health encompasses many factors, such as prevention, impact, equity, and justice.
Throughout our fieldwork experience, we observed how certain determinants can impact one's opportunity to lead a healthy life.
Factors such as geographical location, socio-economic status, employment, education, housing and gender can all play a role in one's access to clean water and healthy food in Pokhara.
In Pokhara, we see organisations such as Cancer Nepal working tirelessly to bridge the gaps between urban and rural healthcare.
Cancer Nepal installs rainwater tanks and polyhouses, along with educating Nepalese people about how to independently maintain their health.
This is key to creating equal opportunities to lead a healthy life in Nepal and around the world.
Equity and justice are fundamental principles of public health, ensuring that nobody is left behind. This is what makes the work of Cancer Nepal and other public health initiatives so important.
This is Public Health is all about educating the public about ways to improve their health and happiness.
Health is not just about the absence of disease, but also about balancing the physical, mental and social well-being of the individual.
Thank you to Cancer Nepal for embodying the true meaning of This is Public Health and showing us the link between social determinants and health equality.
So remember, public health is not just a field of study, and it's not just about basic health. It's about building communities and lifestyles that focus on prevention, impact, equity and justice.
Public health is about creating a healthier world for all of us.
Done your part, mate.
Okay, so the students had a lot of fun in creating those videos, and we got students to do the same thing in Fiji, create slightly longer videos, and we actually evaluated those videos and evaluated students' engagement with them to see if it was an effective kind of a means of getting students immersed in the communities. So moving on to the Fiji trip, that was slightly larger. We took 23 undergraduate and postgraduate students, and we work with an organisation called Friend, who work on sustainable kind of solutions for prevention of different health issues in underserved communities in Fiji. And this was a different kind of a field trip because our students were really immersed in the culture. They were split into small groups and were hosted by different villages around Lautoka. And as I mentioned, that as part of that, they created a 5-minute video, which we promoted widely on social media. And the evaluation of that, we were fortunate to present at the Western Australian Teaching and Learning Forum. Now, I did really want to show you an example of the video. It's one of the videos from Fiji, but as I said, they are a little bit longer, and I'm conscious that we don't have a lot of time tonight, but I believe Rebecca might be able to make that available on the website at a later date. I would just like to take you through the student feedback on the video, because for us that was a really new thing, and we're hoping that it would lead to engagement for students. So we collected both qualitative and quantitative feedback on the video component. And as you can see in this slide, some of the qualitative comments showed that doing the video really helped the students connect with the community and get involved with the community and really form those meaningful interactions, which was really pleasing for us to see. And yeah, another student commented that it was a great way to get students more involved, and just that ability to be creative made it a really nice assignment for students to complete. We also collected some quantitative feedback, and you can see from this slide here The quantitative data showed that this type of assessment was really effective in creating a useful learning activity for students, and they were able to increase their awareness of public health issues in Fiji. They increased the depth of their understanding of public health issues, and it really enabled them to have those meaningful interactions with community members, which was really important for us, but also important for the communities that we visited. And they certainly had a lot of fun in getting involved in the videos. So just to conclude my presentation, overall, the video component, which was what was really tied to the This is Public Health grant, was a really useful and enjoyable learning experience for students. It really allowed them to show their creativity, to meaningfully engage with their communities, and really develop some tangible outcomes. The communities that we visited were really happy to receive the videos at the end and see themselves featured in them. So certainly it's a really good resource, for us to use in future, and it's certainly something we'll consider doing again on future field trips. And I guess I just wanted to finish with a comment on the field trip overall. This was a comment from one of our postgraduate students who said, "I'm incredibly grateful to have had this opportunity. My life and subsequently professional practice will be forever changed through this experience." So it's really nice to receive that kind of feedback, and we get a lot of comments like that about how, I guess, how that immersive cultural experience has really shaped students' views of public health and how they might want to see their career play out in the future. So just to finish, I really want to thank everyone for the opportunity to present our work to you, and thank you so much to the team at the This is Public Health Global Grants for the opportunity to really complement our field trip nicely and engage on a much deeper level with our communities. So thank you so much.
Thank you, Julie, for that very interesting intervention of so many public health things that can be done at the community level. At this next stage, I want to present our next presenter, Piyusha Majumdar from IIHMR University. And the topic is Public Health Podcast for Low and Middle Income Countries. Welcome, Piyusha.
Thank you. Thank you so much, Margaret. Hello, everyone. I'm Dr. Piyusha Majumdar, and I, along with our Global Student Ambassador, Yashwant Sonati. So we are presenting our project, which is on public health podcast for low and middle income countries. And we have produced a podcast that's available on Spotify by the name of Ensure Health. Now I request Rebecca to just play this video, which is our recorded presentation.
Hello, ladies and gentlemen. I am Dr. Piyusha Majumdar, Associate Professor at S.D. Gupta School of Public Health, IIHMR University. IIHMR University, Jaipur is a recipient of TIPH, this is Public Health Global Grant, Cohort 2. We are showcasing our TIPH, which is producing public health podcast for low and middle income country. The goal of the project is to dive directly into thought-provoking topics necessary in the arena of public health for learners, students, academicians, public health policy making, and hence making an impact in the public health arena. IIHMR University is a premium university, leading educational institution engaged in the area of public health since last 4 decades. IIHMR is dedicated to the improvement in standard of health through better management of healthcare and related program. We are located at Jaipur, also known as Pink City, in the Rajasthan state in India. We have named the podcast project as Ensure Health, designed to create illuminating discussions, expert insight, and groundbreaking research on the path of universal health coverage. This is our first teaser of the design logo and other podcast details. The ongoing pandemic has demonstrated that there is a dire need to strengthen capacity,
competency, and knowledge in the area of public health, like politics of public health, community engagement in building trust, science and art of implementing public health program, and promoting implementation research. In order to do so, IIHMR is producing podcast by the name of Ensure Health. Ensure Health will discuss thought-provoking health topics, innovative and inspiring research that contributes toward achieving universal health coverage from low and middle-income countries. Ensure Health will bring latest evidence, research, and experience in public health through experts' call. And evidence and expert can help journal people and public health professionals understand the latest research. So, wait for the next episode of Ensure Health, and the podcast will be available on the IHMR website.
Team comprises of higher management at IHMR, Dr. S.D. Gupta, who is the Trustee Secretary at IHMR, Dr. P.R. Sodani, President at IHMR University, Dr. Vinod Kumar S.V., Professor and Dean in Charge School of Public Health, and Dr. Piyusha Majumdar, Faculty at IHMR University. A team also comprising of young volunteers including Dr. Yashwant Sonati and our bright MBA first and second year students Namisha, Ashna, Chandan, Pratik, Suramya, Shubhi, Trisha and Priyanshu, who were involved in making content, creative and have done social media campaigning of the podcast. We have produced 8 podcasts on varying themes featuring experts like Dr. S.D. Gupta, who is a former president, Southeast Asia Public Health Education Institution Networks, that is CFIN, Dr. N.K. Arora, Natagi member and Executive Director, INCLIN, India, Dr. Hisham Musin, scientist at ICMR, Dr. Hemant Shivade, scientist at Indian Council of Medical Research, Dr. Sanjay Sharma, CEO and Managing Director of Association of Transgender Health in India. We have Professor Suptendranath Sarvadhikari, who is a digital health educationist, and Dr. Venkat Changavalli, CEO, Emergency Medical Response in India. And all these episodes are available on Spotify. Global Student Ambassador and volunteers have been also engaged in producing podcasts on the mental health dialogue. Talking about the unique podcast content, we have covered topics like Public Health 3.0, which is a renewed approach to enhance and broaden public health practice. How to engage and collaborate to improve social determinant of health. We delved into a topic of implementation research, how to bridge gap between practice to policy, and innovations in implementation research. We also unlocked the secret of innovation with respect to digital health and how digital health and innovation in India can play a role in supercharging emergency response, which can empower paramedics to move faster and save human life. Our unique podcast content is not only limited to gender issues, but also explored the health of those who are invisible, vulnerable, and sensitive. We talked about transgender population, their risk and vulnerabilities, and public health program to address the challenges in accessing services. Our podcast also focuses on highlighting community issue of mental health, in which a student volunteer share their perspective and experience in the area of mental health. IIHMR's Global Student Ambassador interviewed one of the experts and walked around the crucial role of operational research in addressing public health challenges. Podcasts have been promoted by using various social media handles like LinkedIn, Instagram, Twitter, WhatsApp, and emailers. QR code for Spotify, LinkedIn, and Instagram have been produced and shared on various forums. A lot of organizations like ICMR, NIE, The Union and Global Coalition of TB Advocate also came in support of our podcast and disseminated the episodes on their own platform. Ensure Health podcast is available on Spotify and it is bringing latest evidence, research and experience of public health through an expert's call. Audience demography shows that it has been reached to more than 4,000 young audience in the age group of 23 to 44 years. Talking about the reach and the impact that podcast has produced, we have created the content of 4 hours and 10 minutes duration, which is very well received by the listener, and more than 80% of the audience belong to the age group of 35 to 45 years. As we have highlighted the health problem faced by transgender, around 8% of the audience belong to TG category. And we have around 500 individual play of each episode of the podcast. Statistics shows that we have more than 4,000 active Spotify impression, and Ensure Health podcast has reached to 23 countries, including India, the United States, the United Kingdom, Nepal, Germany, Uganda, Singapore, Nigeria, Sri Lanka, Thailand, Malawi, Belgium, Ghana, Luxembourg, Australia, Bhutan, United Arab Emirates, Canada, Switzerland, and Kenya. We are elated to share that the promotional material of the podcast is widely circulated on the social media sites like LinkedIn, Instagram, and Twitter. And we are happy to share that it has more than 10,000 impressions. The team has developed creatives, video, and audio that have reached to more than 10,000 people. There are more than 4,000 active Spotify expressions from 23 countries. Student community engagement has been an integral part of the podcast, and we have been tried best to engage young public health professionals in disseminating the information about the podcast through various means like badge distribution and generating discussion in their interest area. IIHMR has been instrumental in organizing various conferences and events for the betterment of public health students and professionals. We have leveraged this opportunity in increasing the audience base, created Selfie Corner with QR code of LinkedIn and Spotify. Our volunteers amplified the podcast and illuminated a transformative show and promoted it during 2 national conferences at IHMR campus. Uplifting healthcare innovation by organizing an entrepreneurs event Utkarsh at IIHMR campus. With a dedicated audience of 1,000 individuals, our volunteers founded a perfect platform to promote Ensure Health and created awareness about public health initiative. And they have done an excellent job in it. Now you can hear the message of our Global Student Ambassador, Dr. Yashwant Sonati from MPH Implementation Science Cohort 1, and another public health student volunteer who was a part of this unique initiative and our podcast audience as well.
Hello, hola, and namaste. This is Dr. Yashwant, TIPH Global Ambassador from India. Over the last year, as a part of Ensure Health, I've worked with faculty, experts, and a vibrant group of volunteers, wherein my tasks range from shortlisting experts to preparing questions to hosting podcasts and even disseminating them. Thanks to TIPH, I've also had the opportunity to interact with ambassadors across the globe. As a public health professional, I am interested in dual burden of disease in LMICs. I look forward to working with a diverse group of professionals to reduce the burden and enable people live their lives to the fullest. At Ensure Health, we are keen on continuing the podcast and expanding the scope of it. We are planning to share the podcast videos on YouTube. Thank you.
Hello everyone, my name is Priyanshu Mehta from IHMR University, Jaipur, and I have been part of Ensure Health since very beginning, and I feel thrilled to share my experience about being part of the team. So since very first episode of the podcast, our team has tried to create impactful content related to public health policies, public health issues, public health awareness, in short, everything related to public health through interviews, discussions, through podcasts. Through our podcast, we have reached a large number of audiences and have become reliable resource for anyone seeking information related to health. I feel grateful and thankful to the university for giving me this amazing opportunity. Thank you so much.
We have produced a lot of merchandise, promotional product like Ensure Health badges, selfie corner made from Sandpond, diaries for student, also the beautiful mementos gifted to our podcast speakers. Talking about the sustainability plan of our project, we would like to extend the awareness activity and start a YouTube channel by the name of Ensure Health and broadcast video podcast on it. We also aim to engage with our CRO country partners and collaborate with other international partners to have a discussion on latest research and public health issue. I would like to end the project showcase with a quote. Public health is a powerful tool to level the playing field and also bend the arc of our country away from distrust and disparity and promote equity and justice by improving quality of healthcare. Ensure Health podcast will continue the effort of educating in the area of public health. Thank you so much.
Right. Thank you. Thank you so much, Piyusha, and your team. You've done an excellent job using one of the social media that we have today. So quickly, let's get on to the third presenter. And this is Philemon Nyongabo from Makerere University. And he's going to talk about building resilience to floods and landslides. Welcome.
Thank you. Thank you so much. My name is Philemon Nyongabo, a Global Student Ambassador on the TIPH grant program and a postgraduate student of environmental occupational health at School of Public Health, Makerere University. And I'll start off with sharing the objectives of this project, which has been raising awareness and building resilience to floods and landslides in the Elgon region. Yes, I'll request Rebecca, can move the next slide, please. Some of the specific objectives that we had was to raise awareness about floods and landslides because this place is in the eastern part of Uganda, and it's a hilly area, that's the Elgon region. And so the low-lying areas face floods, and then the areas that are on the hilly places get to experience a landslide, especially during the long rainy seasons. But also the other objective we had was to build a resilience to floods and landslides. So we want to see how are people able to cope up, are people able to cope up in the event that landslides and floods have happened. How do they respond? What do they do? And I also see that we were involving students, and there were many things they were able to learn. And the other objective we had is also to promote public health and more so the field of environmental health, which is a part of public health. Yes, in the next slide, I'll be showing you the methods. We used number of methods, and one of them is the stakeholder engagement. We had scoping visits at the start of the project. So here we engage the city health officers, but again, we also engaged the different administrators of the schools and the head teachers, and also the school teachers themselves. So even the other tertiary institution in Mbale City, which teaches environmental health. So the other method we had was, of course, health education. So this was the major intervention or the major activity in the intervention, where we engaged the students and we were able to reach over 2,000 students in health education. And here we're teaching them about climate change so that they can understand. But again, how should they respond during floods and landslides? So these are students. Why did we choose students? We chose students because we believe they are a great change agent in community. Majority of these students come to school and then they go back to their homes in different places of the whole district. So we thought that involving the students while they're still young is more of a sustainable way to continue having change even in their community. We also had seminars. So we had a climate change seminar at School of Hygiene in Mbale, and we're able to reach out to a number of students and discussing climate change and their role in responding to floods and landslides. Of course, we had pre and post assessment surveys. So we had pre-assessment before we started the health education, and then we had post assessment surveys after the intervention. So after the health education sessions, we left an essay writing challenge to these students to be able to write a challenge, find out from the environment what are those aspects about climate change that they have to address, and they have to come up with an essay about what they should do. So we ended, of course, after that, we are awarding them gifts, awarding the best entries that we got. And that is one of the photos where we were awarding the certificates. And of course, we also involved the students in fruit tree planting. So in each school, we're planting trees. So these students would lead in planting the trees as a way of ensuring continuity. So each class is given the responsibility to look after the tree so that they are involved in preserving and promoting environmental health. In the next slide, I'm showing a few results, a summary of the results that we got from this project. So we're able to reach 2,200 students in 5 schools. So these schools included primary schools and also secondary schools. And we saw a 25% knowledge increase within that short time in regards to awareness about climate change, what causes climate change, and what are the effects. Again, we also saw 19% knowledge increase on how, on the knowledge on how people should respond to floods, particularly students and young people. What do you do in the event of floods? What do you do in the event of landslides? So we saw that increase within that short time. And again, we're able to see a 29% knowledge increase on the roles of environmental professionals, public health professionals, what they should do. And we actually motivated people to study with an ambition to be public health professionals later on in the future. We had 350 climate change accelerating challenge essays in a period of 1 month, and also we were able to award 10 winners. So we had the first runners up and also the winners. We give them prizes and certificates. Even to the schools, they were given certificates of participation. We had 30 school teachers involved, and these also got to understand more and more about building resilience to climate change effects like landslides and floods. And of course, from the university side, Macquarie University, we had up to 12 students involved, volunteers involved in implementing this project, and also other students from Mbale School of Hygiene, which is another tertiary institution that is involved in training environmental health practitioners. Yes, in the next slide, I just highlighting a few quotations that we got as feedback from the health professionals. The Mbale City Environmental Health Officer said we should definitely continue this collaboration with School of Public Health and expand this project to other schools in the city. And actually, I remember one of the head teachers talking about how this should continue in the schools, that she was surprised seeing how students were very much involved in writing these essays. And she was actually surprised at how much we had seen in regards to the project achievements in that period of time. So in conclusion, in the next slide, we got to see that engaging student communities is actually a sustainable strategy. If actually some of these strategies involve students, it will help us in ensuring sustainability right from the young stages of life. And of course, we hope to continue this, especially activities that don't necessitate a lot of resources, aspects of essay writing competitions, and also working with other student-led organizations in creating awareness. Yes, in the next slide, I'm showing you part of the project team that we had. You can see on the top left corner, that is Dr. Ndejo Rollins, our mentor, and he was able to mentor us all through this journey. And also, that's part of the team. Volunteers were having a meeting, deliberate, and that is on one of the schools where we work. And that is myself right there on the bottom right, presenting at a conference the findings from this. So in the next slide, I'm just making a few acknowledgements to, of course, the grant program. This was an exciting opportunity to learn, especially for us as global student ambassadors. We're able to practice and be able to learn. Of course, the university with the support from the staff and the Mbale City Authority, but again, other organizations that we worked with. So thank you very much, and it was a great opportunity. Thank you very much, even to those who have joined us to be able to take part of this. Over
Thank
to
you,
you.
Philemon. Yes, thank you, Philemon, for that very interesting presentation on a very current issue of climate change. Now we're going to have our last presenter, and I'd like to welcome Faith. Faith Onyangore is from the University of Kabianga, and she's going to talk about increasing uptake of public health courses. So welcome, Faith. Faith, we are not seeing your slides yet. Thank you. Go ahead. Are you muted? We cannot hear you. Faith, we cannot hear you. All right, go ahead. I'm not sure if others can hear Faith. I cannot. We cannot hear Faith. Oh,
We cannot hear you, Faith. Please try to check and make sure that the input for your audio is coming through your microphone.
There seems to be a problem with Faith's microphone. We cannot hear her. We can see your screen, but we cannot hear you. At this point, maybe we can go on to some questions. I hope that the participants had recorded some of your questions. And at this point, as we're waiting for Faith, if you have any questions, you can go to the Q&A and write your questions on the other 3 presentations that we've had. No, I don't think we can hear Faith, unfortunately. So let's just go on to the questions, and let's hope that her slide will be available later on. So any questions from the audience at this point? You can submit your questions using the Q&A button. Yes, we have one question. What are some of the lessons learned from these projects? So any one of the 3 presenters, you can answer if you've learned any significant lesson from your project. Yes, Piyusha, go ahead.
It was a very nice experience to work in these projects, but as you know, every project has some lessons. So we also learned that. Initially, we were you know, making podcast on the audio mode. And once we did that, we come to know that maybe we got some more audience when we do it in a video mode. So that was our lesson learned. And that is why we thought that, you know, in our next year, when we'll continue our project, we will be making the video podcast. Because, you know, the more people see, the more they, you know, they tend to learn. So that was mainly our lesson.
Any challenges that you had as you were carrying out your project?
A lot of challenges, especially you know, some technical challenges, you know, because this is altogether new thing for us. You know, first challenge was where to you know, broadcast that podcast. So that was the main challenge. So we come to know that there are multiple channels where we can do that. Then we fixed on one, that is Spotify. So this is like, you know, some of the challenges. Then there was a challenge in finding the audience also, and how to reach to that audience. How can we increase our audience base in both Spotify, and we make various social media handles also. So we made our channel, you know, a page on LinkedIn. We made a page on Instagram. So we used several social media tools to do that. So all these things require a lot of brainstorming, and I'm really happy that all my students, our global ambassador and our volunteers, the young mind, they really helped. And, you know, they gave most of the suggestions that, ma'am, this is the way we can do that. And if we make a QR code, and, you know, in that way, we can increase our audience base. And another challenge is not many people are on Spotify. So that's why we thought of extending it to the YouTube and making it a video. So that was basically our lesson learned.
Great. I wonder about the others.
Hi. Can you hear me now?
Yes, we can hear you. Yes, we can hear you, Faith.
Okay, I've tried checking. Can I present maybe, if you don't mind?
Yes, yes, go ahead. Try again. Try again. Meanwhile, the others can have their questions ready. Go ahead and
can
no,
you
we
see my
cannot
slide?
No, not yet. Cannot see your slide yet. And I see a message from Richard. Richard is saying that they plan to continue with these grants. That's really great news. And he's very impressed with all the presentations. Thank you, Richard.
Are they up now?
Yes, yes, go ahead.
Okay, sorry for that hitch. Mine is also a simple but a very impactful work, I can say. I want to say thank you for the funding. And it was about the promotion of uptake of the public health course. And I integrated it with the school health program. In our country, I mean, we have this issue of people believing that perhaps nursing or clinical medicine are the it health courses. So I've done some work on increasing the sensitization by targeting the high school, especially for the public health market. So school health projects are implemented through a school health policy, and at a lower level, the ECDE, that I didn't find it useful to do at the ECDE. They have quite a long way to go. And we do that to prevent diseases, major diseases in schools, because we've had mortalities and morbidities in schools. So the most important tool is the BCC, that is the behavior change communication. And as diseases covered in the school health policies are majorly communicable and uncommunicable, and injuries and other occupational health concerns, as well as food safety issues. So I structured it in a way that as we were going to check, because there's also a very big gap in implementation of the school health. I mean, it is there mostly like on paper, but following the indicators to the core is a problem. And also there's a big gap, I can say. And also people who should understanding what really public health is when they are doing the choices towards the joining of the university. So I can say that has been a very big gap, and I'm happy that the work that we did using the project made a very big change. So at the end of it, we had a target of slightly less than what we achieved, but you can see that we had about 6,000 head teachers in the schools. Not head teachers, students, I mean. Then the head teachers, about 30, and the teachers 300. The public health officers in the field, 15, the county health education team, we moved to engage them and the education, because there's a disconnect in implementation of this is being implemented in schools, but there's the disconnect between the health department and the education department. Then I'm glad that I also reached out to the national health coordinator for the school health. So initially the baseline, actually there was very poor implementation of the school health indicators. We have very clear indicators on what should be achieved. But when we went there, it was below, I think below 20% in the schools that I visited. But after the sensitizations and the revisits afterwards, there was a slight of increase. Maybe given more time, the percentages will go up. And also they agreed, the approach was that they elect school health teachers who will focus and be focal point persons for collection and reporting of the school health indicators. And as it is now, I visited the National School Health Coordinator, and they are glad in what we are doing, and they are ready to take in the recommendations that we did. So majorly we did the information. We moved in with a team of University of Kabianga. We have a marketing office and short courses. Then there was education in terms of leaflets and communication, where we had FGDs with the school teachers, and of course now the students were being called like for assemblies or something. Then we are given an audience to educate them on proper school health, how they should live in school to be healthy, and also the public health course. So if we go back to the goals, it was to raise the awareness and raise sustainable advocacy measures towards public health and the school health implementation to reduce disease morbidity. So I'm glad to inform the team that with actually the last just enrollment in September, we had a struggle, especially when the program was still environmental. So once we started the public health, there was a surge of numbers in the undergraduate program. I'm glad that we are commencing because of this need from the field, the Masters in Global Public Health. September, a partner came in, JICA Hands. We went with the team to Nairobi for the joint implementation of the school health. And then they've now embarked on recruiting school health teachers to promote school health. And then University of Kabianga will host a short course to train school health teachers on proper implementation of the school health policy. And then we have we've now scaled it up to the national level. So I didn't have so many graphics or videos or whatever. We've done quite a lot of work. And just a photo when we were out there together with my ambassador, who is among the students. I took the students out as well to talk to them about public health and the experiences that they've had. And it brought a very big, significant change in terms of the way they were thinking. And that was a message from the national coordinator that we are really happy in what you're doing in the school health space. That is the national coordinator. So I really want to thank the funders, I thank the University of Kabianga and all the participants. Thank you.
Thank you, Faith. Thank you for that presentation, which is talking about increasing public health courses, a very important topic for us in this world. So we have a few minutes. If we still have some questions, please put them in the Q&A, and I'll ask the presenters to address each of the questions. Meanwhile, as we are waiting for the questions, can the others talk about any lessons learned, like Julie or Philomene, any lessons that you learned, any challenges that you had as you are implementing? I'll start with Julie.
Thanks, Margaret. In terms of lessons, I guess the video is really allowed to capture that art and science of public health that, for students, and I guess them being able to explore that, and I guess it fostered creativity and allowed, I guess, a deeper engagement with some of the public health issues that they were looking at. And it was also a bonding experience, which helped, I guess, develop rapport and therefore get better quality information from the villages that they were working with. In terms of challenges, it was very much around logistics in terms of electricity and being able to charge devices and that kind of thing. And internet connectivity was really patchy. So students did have quite a few challenges in that regard in actually pulling something together that they were happy with. But overall, it was a really positive experience.
That's great to hear. I see that, Yeshwanth, you've been having your hands up. Do you want to say something?
Yeah, I already briefly mentioned it over the chat as well. What I wanted to mention was that iteration is the key. That, many of the plans that we initially made, we had to change them when we learned that, there can be a better way of doing this. For example, we were initially recording over Google Meet or Teams, but we learned that there is this platform called Riverside, which helped us improve the audio quality and, capture it in a much better way. And we started using it, which was something we did not know, if not for the podcast. So we learned that we need to keep it rate and keep an open mind, which helps us improve and do things better. Thank you.
Thank you. How about Philomene? Any challenges, lessons learned? And probably to all of you, how would you like to see your project or work expanded in the future if the opportunity arose? Let's hear Philomene first. Challenges, lessons?
Yes, thank you. Yeah, of course, there were quite a number of challenges, including the schools have their own programs. So if you are coming from outside, you therefore need to fit within their programs, which may not always be the case with project timelines. So I've had one of the lessons actually we've had to is how to adjust, engage and work with them and see how to adjust your work plans to fit the target audience that you're targeting. So I think that is one of the outstanding when working with schools or with students. Yes. Of course, we hope to see actually this expanded. We want to engage these other tertiary institutions that are in the same region to see how perhaps every period, maybe they can have students involve other students in creating awareness and promoting resilience towards floods and landslides. Thank you.
Thank you. How about the others? How would you like your project or work to be expanded in the future? Yes, Julie.
I mean, we're really hoping to continue promoting that This is Public Health message with future field trips, and still, using the videos as a way to engage with the community. But it's also a really good catalyst for a talking point about public health issues within communities, because a lot of the things that are impacting the communities that we work with, they're not necessarily viewed as public health, but with that, with the This is Public Health message, we can kind of shape them into something that is really, I guess, a core component of public health. So we'll definitely continue with what we've been doing.
Piyusha, are you going to continue?
Yeah, definitely, because this is such a nice platform, and I think there are a lot of listeners, and the public health community and the public health professional would definitely like to learn from our podcast. So we will definitely want to continue it. And as I said in my presentation, that we will expand it to, and we'll try to make a YouTube channel on Ensure Health.
We look forward to that. Yes. and Faith, what about your work? Because public health education is really critical. Do you want to continue expanding what you're doing in Kabianga?
Yes, definitely. My vision is that beyond this, not even just more of a scale up the project to be rolled out, whatever that will be able to develop or improve in the school health implementation. Of course, there's a lot of morbidity and mortality to be rolled out. We hope to develop a very good, perhaps it will for ease of capturing of the indicators in schools. So we hope to roll out to the county and also the country at large to reduce mobility, and also the cause will be known, as we spread out the tool.
Great. Great to hear that. So at this point, I think we are really time on. I'd just like to thank the attendees. Thank you for staying there and listening to these great presentations from different parts of the world where we're looking at public health issues. And just to remind us, I think there's some upcoming sessions. There's a session on the 23rd of this month and another one next month at 10th of June. I'm sure we'll get the notices. Yes, 23rd and 10th of June. So you're most welcome to attend these sessions and to learn more about TIPH and what it is doing around the world with different partners. So with that, thank you so much, presenters. Thank you so much, attendees, and we'll see you next time. Thank you. Bye.
Bye. Thank you.
Thank you, everyone.